Hello, my name is Bob Zanni. In this module, I will discuss an important quality improvement tool, the Fishbone Diagram. It is also known as an Ishikawa diagram and cause and effect diagram. We continue to travel through the microsystem improvement process spiral. We are in the final steps of the diagnose phase, having created a global aim statement, a detailed process map, and a specific aim statement. To help us move forward, we will construct a fishbone diagram. Science is about understanding cause and effect. The fishbone is a scientific tool used to illustrate cause and effect. Cause and effect diagrams give you more information about causal factors influencing your specific aim and related processes. The diagram helps the team understand the forces that are contributing to a specific aim and thereby identify what might be changed to attain improvement goals. The diagram helps illustrate a problem by visually depicting the details to show how they fit together within a system. Remember, effects are not usually the result of one cause. Outcomes are almost always the result of many interrelated causes. The graphic depiction of this concept more closely resembles a spider's web. A cause and effect diagram in the form of a fishbone diagram provides a straightforward way to translate a web of interactions, an easy to understand visual display of cause and effect. The fishbone diagram is an important tool used to identify and clarify the causes of an effect of interest. Remember, healthcare is complex. Outcomes are a result of a constellation or web of causes. Improving healthcare requires management, improvement of the most important causes of undesirable outcomes. Fishbones can be used to brainstorm the root of a problem. A fishbone diagram is an organized picture of the factors thought to produce a result. As you will see from the upcoming examples, the big arrow points to the result, and the bones off the big arrow show major contributing factors or causes producing result. So how does one create a fishbone diagram? The fishbone diagram looks like a fish skeleton consisting of a spine and attached bones. You will insert the result at the end of the arrow, shown on the diagram as number 1. Major drivers, shown on the diagram as number 2, usually include the categories of equipment, people, process, environment, and materials. The discrete causal elements or smaller drivers, shown as number 3 on the diagram, are added to the major drivers. Here is an example of a cause and effect diagram depicting lengthy appointments in a clinic. The major drivers listed are people, equipment, materials, and process. The causal elements, or smaller drivers, are listed on the diagram. Let's look at the major driver of people. The smaller drivers, or causal elements, add to lengthy appointments. And these include inconsistent clinical staff, no one person is responsible for patient flow, providers are late, support staff not trained well, patients arrive with more needs than originally stated, and support staff unprepared for patient visits. In continuing with the University of Cincinnati's work, I have included the fishbone diagram that team constructed illustrating the many barriers to initiating the discussion about lung transplant with patients. Some additional major drivers were added with a list of many causal elements or small drivers. Let's focus on one major driver under patients. And as you can see, there are many causal elements which have been included. These include patients lost to follow-up, patients having inconsistent visits, patients unable to make the decision about transplant, or denial, or not being receptive to discussion at all. Some other elements included lack of an educational program for patients, social support, financial barriers, transportation, and insurance. There is a copy of this diagram in your course materials for further review. The template for creating your own fishbone diagram is included in your module materials. In summary, a fishbone or cause and effect diagram is a very useful tool in improvement work, particularly where there are multiple factors. Fishbones can help teams understand the root or roots of the problem they are working on. It can help support teams to visualize root causes, and can help facilitate discussion and diagnosis of the problem. Fishbone diagrams lead the team to the next step of change ideas. Here are the references for your review and further reading on this topic. This completes the modules covering the components of the diagnose phase. The next modules will guide you through the next phases of the microsystem improvement process spiral. I thank you for your attention, and as always, I wish you the best of luck in your quality improvement journey.